I would like to introduce myself. I'm Dr. David Jernigan. I'm the owner of the Hansa Center, four-doctor practice, specializing in chronic illness. And what we're going to be talking today about is something so revolutionary, so new. We innovated this technique and technology here at the Hansa Center. So you cannot get some of these treatments anywhere else in the world right now. And what we're talking about is based on the science and the understanding that the body isn't just some bag of chemicals that when you eat the food that you're eating right now at lunch, it's not just like a bag of chemicals that you eat the food, it kind of gets digested, it all kind of bumps into each other until it finally gets to every tissue the way you think it should. Your body has software. That software is a lot like this laptop that we're running here. It's a dual processor. The dual processor aspect of the human body is the heart and the brain. So most people don't realize, I mean, everyone gets the whole brain concept, right? That it runs everything. That's what we were taught, right? The brain runs everything. It's the CPU of your body, if you will. But that's not really the full story. Because it turns out 65% of the neurons in the heart are identical to brain neurons. 65%. That the heart has a brain of its own that actually, according to the research, knows the truth of all things 5 to 10 seconds before your head brain can even engage on what it's looking at. Now think about that. 5 to 10 seconds before you consciously know something is even coming, your heart already perceives the fact that somebody's maybe going to walk in the room. 5 seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, right? 5 seconds. That's a long time, isn't it, to be ahead of your brain. And yet we don't get taught to listen to the heart level brain. It's not a gut sense, although it would feel that way a little bit. You know, like we say, oh, I had a gut feeling that something bad was about to happen. And it's probably the heart perceiving things, it turns out. So the dual processors are the brain and the heart. And they have to, just like the processors in your laptop computer, they have to coordinate everything that's going on. So the heart and the brain must communicate in order for your body to function correctly. We're talking about things like dysautonomia. That's like again, the autonomic nervous system is just dysfunctional when we talk about dysautonomia. We talk about people with POTS. That's postural orthostatic tachycardia, where their heart just races uncontrollably when they stand up or sit up or do different movements. And guess what? With this new technology, the autonomic nervous system is coming online. Now, the autonomic nervous system, and the POTS, by the way, is going away, which is phenomenal. I mean, I don't know how many, but hundreds of thousands, if not a million people in America alone have problems with this in some form or fashion. Imagine fixing these things in one office visit practically. That's remarkable, isn't it? That's why we're so excited about this innovation. We now know that the heart is what runs the tissues. It's actually where the software originates. Now, how many were taught that the heart is a pump? That it's pushing blood? As fundamental as that seems, like everyone knows that. Every child, I think, if you went up and said, what pushes the blood through your bloodstream? They go, the heart. Actually, blood moves autonomously of the heart. This is based on Ralph Marinelli's work and some cardiologists that have been doing studies. Even Jacques Cousteau got involved in that. Remember the old oceanographer? He found that even the simplest single-chambered hearts of marine animals, none of them were pushing blood. It's not a pump. Blood is 6 times thicker than water, and it's theoretically you're having to push this very thick substance, blood, through 50,000 miles of blood vessels. Now think of that. That's almost all the way around the planet. And a red blood cell, it only takes 20 seconds to do a full cycle through the body. 20 seconds. You follow one red blood cell at 20 seconds. Isn't that crazy? So, the heart, if it isn't a pump, what is it? It's that computer, right? It's that dual processor. And with every beat of your heart, there's all kinds of electromagnetic frequencies that are being emitted in the sound of the heart wave, of the heartbeat, I mean. And when the heart beats, it's also emitting laser-like emissions. Now, like this is a laser. If I can push the right button, somewhere on here is a laser. See? The little red light laser? That's coherent light. Okay? That's emitted from your heart that imprints the DNA in your body. The DNA emits light. Now, is it just like a light bulb? It's either on or off? No, this light contains the information that enables your body to adapt to its environment instantaneously. That's where disease is. The inability of the body to adapt correctly and instantly to changes in its internal and challenges in its internal and external environment, right? So it would make sense that if you had dysautonomia, if you have some sort of illness that isn't resolving, that you might want to look at the software that's driving the whole thing. This is that software of the human body that we're talking about. Now the DNA, like this slide says, the DNA emits about 90% of the cellular light. Did you know your body emits light? Even the Bible said that when the children of Israel were complaining about the fact they had to fast, it was God answering them, and he says, "Don't you get it?" That's my God voice. Don't you get it that if you would fast with the right heart and mind, that the light of your body would burst forth like the morning sun and health would follow speedily? And now we see the body really does run itself via light. We thought that was a figure of speech, didn't we? Every square centimeter of skin is emitting 1,000 to 2,000 photons per second. In the last 3 hours of life, they've measured, and you're emitting huge amounts of light. Huge amounts. And at the instant of death, there's a flash of light, and then there's no more. And yet, how am I supposed to test the light of your body when that's actually a huge part of what's running the body? So when you're a patient here, and we're doing some of these things that no other doctor has done because we've innovated them here, things like neurophotonic therapy, where we're actually challenging your body with different frequencies of light, right, colors, and seeing what goes wrong in the body. It's really like I'm actually causing a problem so that I can find it in the first place so that I could correct it. So it's like challenge doctoring. I'm trying to come up with a term for this type of doctoring. I don't like challenge doctoring, but it really is like we're pushing your body to reveal where it's broken down so that we can fix it. Because no doctor in the universe can even fix a paper cut. Do you know that? The world's greatest, most celebrated physicians cannot fix even a simple paper cut. Your body has to do that. If the paper cut didn't heal, what's your doctor going to do? He's going to stitch it up, maybe. I mean, if it's deep enough paper cut. But he can't make that thing heal. The idea would be that the doctor would identify what's preventing the body from healing and provide the body with the building blocks and the information it needs, because very often, if it's a software problem, it needs a software correction, right? You can't fix that with a vitamin, maybe. You can't fix it with a mineral. You can't fix it definitely with a pharmaceutical that just covers up the symptom, right? So we have to be able to use energetic means to address energetic problems. And once that's done, then the body can heal that paper cut. That's just a simple paper cut. Now, that biophotonic emission that's coming out of the heart also regulates and communicates information to the brain and the brain to the heart. So it makes sense that if there's a problem in that system, there's going to be problems everywhere. Not just, that's why when people come and they call us on the phone and they say, well, I just want you to fix my knees. I'm like, no, we're not that clinic. We specialize in the chronic illnesses. We're not a knee pain clinic. Because you know why? Especially for somebody that has a non-traumatic knee problem, meaning they didn't fall down and hurt it, they weren't in a car accident, they just woke up one day and it started hurting and it's just progressively gotten worse. To me, And all of our doctors were thinking, knees are on the same circuit with the kidneys. The kidneys are on the same circuit with these front two teeth in the top and bottom. You know, the psoas muscle is on that same circuit. And then you start putting it all together and you say, okay, so you have knee pain. Do you have low back pain and weakness in your legs? Oh, yeah. And they go, how did you know? I didn't tell you. I was like, because kidneys control the strength and vitality of your low back and legs. And then I kind of go, your menstrual cycle's off, isn't it? And they go, yeah, how'd you know that? It's like, because your kidneys help regulate the reproductive organs. Wow. And these people are like, I usually have to be able to tell the doctor everything, and he doesn't even want to hear everything because he don't want to be responsible for everything. He just wants his one little piece of the puzzle. Send you down the hallway for the next part, right? But our doctors were trying to see every person as like, how do I get every single thing that's gone wrong in the body corrected as rapidly as possible and as gently as possible. And that's why we do what it is that we do. So, let's say your heart and your brain don't agree. What happens? This is a good example. Polygraph test, right? How does the polygraph test work? We got the Pinocchio, and he's taking a polygraph test, and he says, I didn't do it. All right, the nose comes out. Well, in reality, what happens on the polygraph, you see on this chart here, this is where he's being all truthful. He's like, yeah, my name is David Jernigan, I'm 6'7", gentle giant, and then it goes, I didn't do it. Well, guess what? This part of your body's computer, that dual processor aspect, can enable you to say anything. Let's say that I did do it. This person did do it. Okay? You can say that. Everyone say, I did do it. Come on, I did do it. Right? See, your brain can make you say anything or allow you to say anything. But your heart can never lie. That part of your system will not. It doesn't have the capacity to lie necessarily. So when the heart and brain are not in agreement, look what happens to the electromagnetic aspects of your body. Not just this one, but this one and this one and this. All these different ways of looking at what's going on, just with a simple polygraph machine. Isn't that neat? When this is going on, just when you're lying, what do you think it's doing when your body is not able to communicate? If this is health and harmony and everything is working correctly, and this is disease because the head and the heart are not able to communicate. They're not even talking anymore. It's like that old couple that just like they live together, but they don't talk anymore, right? Then disease is going to happen. So, every function of the body and the mind is being controlled electromagnetically by the software. Now you might say, well, Dr. Jernigan, it's not just that easy. It's also neurotransmitters, and it's neuropeptides, and it's hormones, and it's all these other things. Yes. And you do have to have your head in agreement with health, right? Right? Positive attitude, that helps. Because guess what? Even the action of turning the corners of your mouth up, even if you don't feel happy, they say that still creates neurotransmitters to be secreted just reflexively to the action of smiling. I used to drive down the road on these 16-hour road trips with 4 children in the back of the car, and I'm like, trying to drive my neurotransmitters. Essential oils worked a lot better. You just put a little bit of peace and calming on the air conditioner vent and turn on the AC, and they calm down. It's the coolest trick ever. So yes, it's all those other things, but I'm just saying, I'm not saying throw out science of physical medicine, right? That's why our doctors are doing physical medicine. There's only 4 ways to get sick. Did you know that? And we don't have any of our farmer types in here today, I don't think. But they could tell you, there's only 4 ways a plant can get sick. Structural problems, right? You stepped on the plant, it's going to have some problems, right? It's not going to grow to the full degree that it was. Chemical problems, if the chemistry of the soil isn't right. If the microbial aspects of the soil isn't right, you're not going to have a healthy plant. Stress-related problems. too much of things, environmental stressors, right? And in humans, emotional mental stress, inherited stressors, barometric pressure stress, like when a storm front comes through, your body's ability to handle that barometric change, like the barometer falls, doesn't it, just before storm, and there's less pressure pushing on the outsides of, let's say the cells are like balloons, so that balloon that measured this much before the storm, when the barometric pressure falls, gets this big. So the old folks know it's going to rain before the weatherman because their knee pain that normally isn't there, or it's maybe there just a little bit, gets exponentially worse because all the cells are swelling, and all that swelling causes pain, and they go, oh, it's going to rain. And the younger people are like going, no, it didn't. And then sure enough. So Grandpa looks pretty cool because he can predict the rain, predict the weather. So there's only one other way you can get sick. And it's like I'm talking about here. That software of the body, the bioenergetic aspects. So we have structural, chemical, stress, and bioenergetics. Bioinformation, if you will. It's the only 4 ways you can get sick. You can describe every single illness. So what do most doctors treat that are for chronic illnesses? They treat the symptoms, and they're treating them with what? Medication. So they're dealing with the chemistry only. Let's say they did a really good job. Let's say they really, really do good and they don't actually mask the symptoms, but they use supplements and no, not homeopathics, but supplements and vitamins of sorts and herbs and stuff like that. Great. You've addressed 1 out of the 4. Well, let's say they're a chiropractor and an osteopath and they also throw in some structural stuff. Great. Now they've gotten, let's say they do a perfect job at both of those things. Great. But you're still missing 2 other things. Well, let's say they do some counseling and stuff. Well, you can't fix everything through counseling. I mean, to me, a lot of the time, this is just my personal thing. Me talking about it just let somebody else know. That never seemed to really help me get rid of anything, right? So I'm like, okay, you got to have other tools and techniques to get rid of the traumas that we've accumulated in our lifetime. And what are those traumas actually stored as? Frequencies stuck in the tissues of those emotional traumas. So again, it kind of gets back into you have to have the right tools for the job before you can get over those kind of things too. So let's say they do some counseling and they do a really, really good job. And they do the chemistry and they do a really, really good job. And they do the structure and they do a really fantastic job. And the patient still isn't well. They say, but I did all these different things. You're still missing all the bioinformation systems of the body. And there's not a lot of ways to even assess that. And what we're going to show you is the latest and greatest that we've come up with. And this type of practice breeds innovation. Our doctors, our 4 doctors, they are phenomenal. I can't even say enough. I think they are just exemplary. They're the top of the top because innovation, they just breathe it. Everything I've ever taught them, they plussed me. And then they come and teach me stuff, and we get to plus each other. And so we're weaving a tapestry of just brilliance, I think. And I couldn't pick better docs. So we're talking today more, though. Let's say that we are addressing the structure. We are addressing the chemistry, as you all know. We are addressing the emotional, mental, and all the other types of stressors, inherited stressors. Like I say, we're also now talking about that software, and that software is controlled. Remember I said the heart imprints the DNA through laser-like emissions? It's not quite really the complete story. Because recently there's a thing called the ENCODE project. The National Institute of Health in Bethesda, Maryland stimulated this project, and it was done in, I think, over 30 different laboratories around the world. All the scientists involved came together and they just published it in the last couple of years. And what they found out was in what they used to throw away when they're studying the DNA, thinking it was called junk matter. They just called it junk. Again, where we just say, hey, let's throw this part out because it's not really relevant. We thought it was just nothing. Turns out that junk matter were 4 million biophotonic switches that as that laser light leaves the heart, it's imprinting all the strands of DNA in your body, but first it has to go through those biophotonic switches. And it flips the switches on and off in different ways, different combinations. Imagine those switches are like a combination lock. Or it's like a prism, like you're shining a light through a prism. You remember those little crystal prisms, and you could shine white light through it, and it would split off into all the different wavelengths? Well, imagine the heart's information that's coming out of there to control and enable your body to know what to do with that new perfume that came through, that somebody walked through the clinic with, right? Your body has to be able to adapt correctly to that new smell, right? How does it do that? People that don't have problems don't even fathom the fact that their body is doing a whole lot of different things to process that smell. It's only in disease do we see just how many things the body is having to do to actually coordinate breaking down that toxin, because anything you can smell is a chemical that's floating around in the air. Isn't that wild? You're breathing in this chemical. And to certain individuals, like that come to the clinic, this is why we have a 0 scent policy. You can't wear deodorant that even smells. You can't wear shampoo that smells. You can't have anything that smells, because until we get these people fixed, it's just like a minefield. The whole world is. It's a minefield. I mean, they'll have problems that you would have shaken off, a healthy person would have shaken off in a matter of seconds. It would take them weeks maybe to get over. That's pretty bad, right? And that's also living very often in the software of the body. It's not processing that correctly. So those switches is what controls what your DNA does. Isn't that crazy? Your DNA is correctly said to be the blueprint of the body. Now, blueprint, if you look at it, a blueprint of the house, does the blueprint tell you what kind of carpet is in the house? Nah. How about the curtains? Nope. How about dirty dishes in the sink? Does it show up on your blueprint? Nah. The blueprint is just what? The walls, the doors, the shape of your house, the windows, things like that, right? The roof line, where the chimney is, where a closet is. Yeah, it's important, but it isn't really what enables you to change what's inside of that house. So the blueprint of your body, the DNA of your body, does make it to where every morning you wake up looking like you. Okay? You don't ever wake up and go, whoa, Clooney. No. Sean Connery. No. I wish. No, the blueprint makes it where you wake up looking like you, but within that blueprint, the switches is what enables you to have dirty dishes in your sink for all intents and purposes. It is what's actually creating the expression of your DNA. Now, if you think about that, that's controlled by these laser-like emissions from the heart, and it needs the brain to cooperate as well. It needs to be able to travel through the tissues of your body correctly without getting interfered with. That's a huge amount of work that has to take place, and our doctors rock through these problems with no problems with the bioresonance scanning and now this NeuroCardial Synchronization technology. And we do that using the latest and greatest stethoscopes. Isn't that wild? A stethoscope. But the software that was developed is so amazing because it reads out just like an EKG. Now this is a lady, this is a real case, a lady that came in, and this isn't even her worst one. But this is her heart, and what we're doing is taking a digital electronic stethoscope that links into a computer, and we take an audio reading of the person's heart in high definition, and you can see, I wish I had a good one so you could see what it's supposed to look like. But this is what's called S1 wave. This would be the same thing on an EKG scan. It would look just like this. So we have the mitral and tricuspid valves closing, and it makes this sign. Then we have a working phase, it's called, and then we have S2, right? And then we have a resting phase, and it goes again, S1, S2. And what that should sound like is that lub-dub, we call it in medicine, that the heart does. We say, boom, boom, right? Boom, boom. Nice and rhythmical, boom, boom. And instead, hers is going, boom, 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 right? I mean, this is like going crazy. And hopefully in a near seminar, I'll actually be able to play the audio recording for you because it doesn't even sound like a heart. I mean, it's just crazy. Some of these beats, there's so many different beats and so much arrhythmia, right? That's where the heart is not beating in the correct rhythm. She has, if you expanded this, you could see she has like regurgitation of blood. It's actually going out of from one part to the next, across the valve, but some of the blood comes back into the heart. Pretty dangerous. There's a whole syndrome called SAD syndrome. It's sudden arrhythmic death. This is where children, athletes, adults, just walking around thinking everything's great, they have no symptoms, and they just fall over dead. They have a heart attack. And it's crazy because, watch, I'm going to show you what happens, and we've done this, we've never not been able to fix this using this NeuroCardial Synchronization. And I want you to keep in mind, it sounds like I'm going to be talking about heart problems, but the true beauty of this technique that we're doing is that not only do we coordinate the heartbeat and get rid of all that regurgitation that's coming back because the valves are leaking and the heart's not working very good, and all kinds of other problems that I could describe just on this person, but we're synchronizing in the process the dual processors of your body. Because we are able to take and record this and play it back to the person through headphones. So you're wearing headphones, listening to your own heartbeat. Embedded in that heartbeat are a lot of the command signals that weren't reaching the brain. And it's kind of like taking a couple that hasn't talked in 30 years. They live under the same roof, they're married, they haven't talked, and then putting them together and saying, okay, you guys got to talk. All kinds of problems start happening, right? They're not used to talking, right? So our doctors can use the bioresonance scanning, identify everything that's going wrong between the heart and the brain, correct it in real time, right then and there, and guess what? It gets synchronized for the first time maybe in your entire life. And as we're going to watch a progression, this is after 30 minutes, okay? That's the first one. Very arrhythmic. Look how close these are. These bigger lines are the S1, and then we have all these extra beats. We got all kind of goofy things happening in here. And I'm going to show you right there. This is after 30 minutes of treatment, and you're already starting to see that it's coming together, can't you? You can start seeing, wow, S1, it's too big. S2 is definitely still too big. This wave here is called S2. We got all kind of regurgitation happening in here. We have the resting phase, and you're going to see it kind of has a sine wave. That's the person breathing. So you see how it does this, like this little sine wave thing that's going on here. But we're starting to see that person come on, so we can take that recording and play that one back through headphones. And the person's, we just loop it. And the person's having to listen to this over and over again. And it's interesting because all kinds of emotional stuff comes up too, because what is the heart? It's one of those seats of the emotions, right? Out of the issues of the heart come all the life and death type thing, right? According to the Bible. So, this is 24 hours later. Again, after a while, you just look at this and you go, boom, 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 boom. The interval between here and here and here to here, these are all S1s. Can you see that the interval looks really good? Everything's coming online. The resting phase is twice what the work phase is doing, which is perfect. Now, I didn't get it put on here this time, but we do have the month later recording. And it's even more pristine. It's just beautiful. Which again, she didn't keep getting treatment. It was like once we got that synchronized, she doesn't have the arrhythmia, she doesn't have the regurgitation of the blood going back in across the mitral and tricuspid valves, she doesn't have the aortic and pulmonary valves regurgitation to much degree. In this one, she still has some issues. Like you see there's a split right here. We see an extra beat right there, okay? But dramatically better. And now, like I say, the next one that we did about 4 weeks later is just perfect. It's exciting. And the cool thing is every doctor here is doing this, and we've never not been able to fix anybody. So this is at POTS. Can you imagine, where the heart is racing? Now you might say, well, is it always a software problem? Well, no. It's the kidneys, right? Because the kidneys also secrete hormones and neurotransmitters. The angiotensin 1 and 2 that the kidneys secrete increase your heart rate. Okay? Bradykinin secreted from the kidneys decreases the heart rate. That's what helps you slow down. If you run, you need to be able to increase, so the kidneys secrete angiotensin. If you slow down and start walking or just stop and just stand there, you don't need your heart to keep going, right? But that's what these people's hearts are doing. They just keep going as long as they're going to stand up. So bradykinin is secreted by the kidneys. But is it just the kidneys? Well, no. What controls the kidneys? You see, it's everything that has to be addressed. It's the 4 ways that you get sick in the first place: structural, chemical, stress, and bioenergetic. And during this 2 weeks of treatment, that's what we're doing. Is in that first week, it's really the big stuff we're eliminating. Just big, clunky stuff. You might say macro problems. You kind of clear out the forest so you can see the trees kind of thing. And in that second week, these are the things. We're fine-tuning. We're just fine-tuning that Ferrari that's your body, right? And health follows speedily. Because again, if we can enable your body to function the way it was designed to do, I don't care what diagnosis you've had. I really don't. Our doctors really don't care. Now, there's certain cases that we choose not to treat, like stage 4 cancer. And by the way, we don't treat any disease. Isn't that funny? People so want me to say we treat things, right? If you go to the doctor, you want him to be able to say, hey, I kill this virus. I'm going to kill this bacteria. I'm going to treat your Lyme disease. I'm going to treat your cancer. They desperately want to hear that come out of our mouth. And we constantly are just like so skilled at redirecting you. All of our doctors are really careful with that, because it's like philosophically even, we're not lying. We're not playing with words. If you restore what's optimum, then the body heals itself. So yeah, the ideal doctor is not the one that specializes in a disease. The ideal doctor is the one that understands all the diseases, yet specializes in how to restore what's optimum. Because if I can't even fix a paper cut, what makes you think I can fix Lyme disease? I can't. Or POTS. Or any heart problem. Or any tissue of the body. Because I don't care what somebody has. None of our doctors really care what you've been diagnosed with. Because with this philosophy of healthcare, we get to win a lot. Very often we're the very first doctor that's ever treated at cause. 88% of medicine, did you know this? By their own admission, 88% of drugs, pharmaceuticals, treat the symptoms. How many of you really believe that you have a headache because you haven't had enough Tylenol? Well, I haven't had my dose of Tylenol. That's why I have a headache. It may work. That's not why you have a headache. You're never having allergies because of a deficiency of antihistamines. Your Claritin isn't fixing anything. Even though you took it one time and it went away just because you don't get allergies that often, you think, oh, Claritin works because I didn't get an allergy for the rest of the year. Nah. No, it masks, it covers it up. Yeah, your body maybe kicked in and finally kept you from having the allergy, or maybe that plant just went out of season, right? The ragweed finally got out of the season and you don't have the allergy anymore, okay? So in this clinic, we're not a big fan of elimination diets. I bet you if I polled all of you, you've tried to modify your diets to try to get well, right? You know, and people are put on these highly restrictive diets to try to fix themselves. And that can help in some situations, so people listening don't scream at me over the internet from now on. It can help in certain regards, and I definitely don't want you eating junk, neither do our doctors. But wouldn't it be better to get your body to the point again where you can basically eat anything you want without having to take something all the time? That's our goal. We don't want to get you off of whatever it is you're taking and put you on what we want you to take for the rest of your life. Honestly, we don't want you as a lifetime patient. We don't feel like we did our job right if you have to keep coming back forever. But again, if you've destroyed your body, through all the other things that you've done, I mean, goodness, we see some crazy things. We have people that are missing more organs than they have. They don't have one kidney. They've had most of their colon removed. They have their stomach stapled. They don't have their thyroid. They don't have their ovaries and uterus. And I'm like, dude, I can't put all that back. Yeah, you may have to be on lifetime care. But if everything is there, all the organs are there, and nobody can figure you out, and everything's up and running, man, this is what I would recommend. People are always wanting me to do phone consults with me, and I'm like, happy to do them. But at the end of the day, they just are wanting me to say the same thing. I can help. Can you help me? Yes. Can you see that anybody coming here, when we're addressing all these different things, using bioresonance scanning, which really enables you to be better than a master, because a master anything, herbologist, master homeopath, master that, master chiropractor, they're all going off of their best knowledge. With the bioresonance scanning, it eliminates that. You can actually know that you know that you know that you need the remedy. You can test before the person's even taken the remedy to see if they're going to be allergic to it, before they've even taken it. They can calculate the dosage. Our doctors can calculate the dosage based on the bioresonance scanning. So we know sometimes you might need this much medicine of a remedy, but you can only tolerate this much. Well, if the doctor puts you on a really perfect remedy, some other clinic maybe would put you on that remedy that's perfect, but they don't have the ability to tell exactly how much you need. They're just going to go off the research. And the research says you need 2,000 milligrams of glutathione. Too bad you had a crisis because you could only handle 1,000 or 500 milligrams. Well, we can do all of that before you've even put it in your mouth. And know that we know no one goes through a healing crisis here. A healing crisis, in my opinion, is where you've been incompletely treated.